lastly, to former Congressman Patrick Kennedy. Patrick has been one of the loudest and most passionate voices on this topic, both in his time in Congress and in his time now in private life. And I'm thrilled for two things. One, to have him on the commission, and two, he lives in New Jersey now. So that's a good thing. As any really smart, educated person would do, and Kellyanne understands this, particularly, he married a Jersey girl. And so it's a really, really good thing, Patrick. So thank you for being on the commission, and I welcome your remarks.
Well, thank you very much, Governor. You took my opener out of the way when you mentioned that I married a Jersey girl. So I'm honored to be on this commission with all of my fellows, and thank you, Governor, for your leadership. It's been extraordinary. I know we've talked before, but everywhere I've been, anyone who's heard that speech you made about a year ago that went viral recognized that you have a unique ability to understand this that many others haven't been able to grasp. So your leadership on this commission is really exciting for me as an advocate, because I know you're not going to bow to anyone, as you have well earned that reputation over and over again. So we're happy that you're our champion on this. And to the secretaries, Shulkin and my former colleague, Secretary Price, it's an honor to be with you. I'll just say very quickly, obviously, parity is the big issue for me. I had the honor of co-authoring this legislation that basically said we shouldn't take mental health and addiction and treat it separately. I mean, it's really still treated separately in many cases, and unequally, which it's still treated unequally. You just look across the medical spectrum. We do not treat brain illnesses like we do any other set of physical illnesses. This is a historic discrimination that still exists in our country, and I'm excited by the chance to kind of push for ways that we can hold insurance companies more accountable so that the public sector doesn't end up having to pick up the tab, because it's taxpayers that are picking up the tab when insurance companies continue to push folks with these illnesses off into the public system. Let's understand, this is a cost shift that is a windfall for those insurance companies if they can get rid of people who have an underlying mental illness or addiction. So, as Governor Cooper said, parity is key, but we can't celebrate parity if we don't have health insurance. So, to the last point he made about Medicaid, it is the elephant in the room. It is the largest provider of coverage for people with mental illness and addiction in this country. So we have to mention the fact that any repeal of Medicaid is a repeal of coverage that we currently have out there. I hope the Commission can come up with some solutions, given whatever happens in the next few weeks on the Hill as to how this nation's going to decide to go forward with Medicaid, to ensure that we don't step back at just the point where we need to be stepping forward on this terrible epidemic. So Bertha mentioned 3 hats she wears. I wear a couple other hats, and that is as someone in long-term sobriety who was addicted, still struggles with addiction from opiates. So I know something about this. I've been someone who's received medication-assisted treatment. I'm also someone who's in 12-step recovery. So this is personal for me as it is for everyone else. I also grew up in a family where addiction and alcoholism was rampant, and like today, it was something we never talked about. So I hope that the other part of this, and I had the honor of meeting with Kellyanne Conway before, is that we can have the President speak about the silence that pervades this issue. Because the biggest way we can move your agenda forward, Secretary Price, on addressing this, and the Commission's agenda, is to have a new attitude towards these as addictions are physical illnesses, not moral failings. And that's not going to happen unless we have the bully pulpit speaking loudly on the importance of treating this like we would any other physical illness. Thanks for letting me.
Patrick, thank you very much.